I'm free.
You are?
Yeah.
Okay. Who's got the kids?
Ian.
The kid.
Ian's
Oh,
off.
he does?
He's off this week, so he's
Oh.
here. Yeah. It's actually
We
like
need
a
to schedule
really
you when
sweet
you're-
setup.
Yeah. Yeah. Yeah, we need
I mean,
to-
she's always at my house, with me.
Oh, really?
But when he's off, he like comes over to the house and takes care of her while I work
Oh.
and stuff like that. Yeah,
Okay.
that's good.
That's weird.
Yeah, yeah. One of my friends was actually Harvey, this asshole that founded Allied Extract, was like, "Yeah, it's gonna be great until there's a new new woman picking your kid up from school." I'm
Yeah.
like, fuck you, Harvey.
Yeah. Well, yeah, don't let him. There's things you can do about that.
Oh, yeah.
That's okay.
Oh, yeah.
Ian's not a bad guy. I think COVID made people go insane.
Yeah.
I don't know.
It did. But still.
Yeah, it's alright.
I've always said men are just big dumb animals.
Oh yeah.
What? Yeah. I mean, it's true, but it gives us a buy.
Yeah, yeah. It's not. It's almost a buy. We are
I
big
don't
dumb
like how
animals.
this thing sounds. What the hell is going on here? Oh, I've got the high pass on. There we go. Now I should sound there. Now I sound
Oh my
better.
god, that's perfect.
Yep.
There we
Okay.
go.
Let's all make sure because that it's on, flat, and 0 dB.
Yes.
Okay. All right. All right. Okay. Almost ready.
Is that better?
Yeah. Was yours not flat either?
I think some. I think somebody's in here fucking with our shit, man.
I do too. I know they have been.
Because this was not the way I left it.
Somebody recorded an album in here.
Damn kids.
Well, I have. No, I've got
no, I'm.
cameras in here. I'm going to look and see if my. No, it wasn't my kids. It would have been the babysitter's boyfriend.
Mhm.
No way. Spicy.
We've been doing
Hopefully
a
it's
wild
not. Hopefully it's
thing.
not OnlyFans.
Oh Jesus.
This IP address.
Oh yeah, OnlyFans. Yeah, I hope it was.
I thought about that for fundraising.
Oh jeez.
Feet.
Feet.
Niche.
There's some funky people out
There
there,
are some funky people.
to say the least.
All right. Okay, there's Sean. Shawnee P.
It's been sitting there for 2 hours, Dr. Steve.
Johnny L's already criticizing Lydia for her potty mouth.
Somebody heard that?
I guess.
Oh no.
Well, I don't remember. What did you say? I didn't
I
hear you
said,
say
I'm
that.
pretty sure I said the F word.
Oh, ooh. Ooh.
Never to be repeated. Ever.
We ain't never heard tell of such words.
All right, Lydia, here we go, sis. That's your. Just take a picture of it and the link.
What is it?
Just for the YouTube.
I was going to send out this YouTube live
The YouTube.
stream.
Oh, the URL?
Yeah.
Oh, okay.
We got it under control.
Now I'm hearing music coming from somewhere.
I think it was me. Yeah, I just hadn't turned mine. We're good now. Let's roll. Let's get it on.
A little rusty already. So now let me call in for the phone call thing, and we'll get Brad on the line, then we'll get started.
Thank you for calling Call-In Studios host and call screener line. Please enter your show or meeting number and Yo Blood, enter your 6-digit PIN number. Welcome, Dr. Steve. You is now in the host room and can manage your funky callers from the Call-In Studio web interface. Laws you is a mess, dat for show.
Dat for All right. There we go. Allied Extract. .org. Okay. All right. I'm calling him.
Okay.
Do it.
He's like currently running ops, asking us to deliver some food to people.
Really?
Yeah, he just sent a message to the.
Hello.
Brad.
Hi.
Hey, it's Dr. Steve. Can you hear me okay?
I can hear you just fine. Can you hear me?
I can. Yeah, you sound great. I'm here with PA Lydia.
Hey, Brad.
Hey, Lydia.
And my partner, Dr. Scott. And we're getting ready to get started. We're going to bring you on at the beginning, okay? Because otherwise it screws up the show. So, is there anything? I've got your. I have your website is allydextract.org, and people can hear us right now. So if you want me to, we're not we are broadcasting to a very limited audience on YouTube right now, but it'll be taken down. But is there anything in specific you want to talk about? I know what you don't want to talk about, so don't say that. But
okay.
Anything that you, any points you want to hit?
There's nothing in particular. We're, I think the biggest strength of our organization is our speed and ability to flex with the emerging needs that they've got. So. Yeah.
We'll save that for the show.
By the time we get something out there and people are crusading for it, then it's already moved on.
Yeah, got it. And so what you really need is support from the public. A little money here and there. People donating would be good, right?
That's the biggest help.
Okay,
yep.
And they can go to allydextract.org to do that.
That's right.
Okay.
That's right.
All right. Because we had Lydia on previously about
Task Force Argo.
Task Force Argo. So our audience knows her pretty well. So anyway, all right. So we're going to get started if you have a minute, and we'll just do 10, 15 minutes, something like that. We won't keep you here forever, but if it's interesting, we'll keep you longer. If it's boring, I'll say, well, I see that they're saying you got to go. So
okay, fair enough.
No,
get it spicy, Brad.
It won't be boring. Okay, we're going to get started here in just a second.
Okay.
All right. So I'm going to pot him down. Okay. All right. He can still hear us. He just can't hear him. Oh, hey, Brad, do you want to use your last name at all, or you just want me to call you Brad from allydextract.org?
Yeah, you can use my last name. Genera.
Spell it.
That's Geneureux.
Oh, Genero. Okay, Genero. I got it. Lydia was like, "Oh, it's hard. It's some French name." I'm like, "Is it Flafalfon?" And she's like, "It's no. That's an easy
French. Grey Poupon.
Yeah. All right, we got it. We got it. That one I can handle.
All right, Brad. Let's do it.
All right. Can you hear that? Otherwise, I can't hear anything. I mean, it looks stupid. It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And also in the studio, back by popular demand, we have PA Lydia. Hello, PA Lydia.
Hello, guys.
And you're back with another crusade, this woman. I'm telling you, she's something else. We'll talk about that in a second. It is LYDIExtract.org. This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. Well, welcome back, PA Lydia. We're very excited to have you back.
It's very nice to be home.
Yes, and you're going to be able to come more regularly.
Yes.
Is that right?
More
because
routinely now.
They've fixed your schedule, so that's awesome. More routinely, thank you. Thank you for correcting me. That's a better word. Our listeners first met you when you were doing some things with Task Force Argo, getting people out of Afghanistan. So before we go on to this next crusade that you're involved in, what's the outcome of Task Force Argo?
Yeah, we're still alive and kicking with Task Force Argo.
Really?
We are. We have, I think we're 250 volunteers strong. We're largely helping the State Department identify people who need evacuation.
Who?
The U.S. Department of State has re-engaged.
Wow.
Yes.
What main wonders never cease. Okay, so good.
Yeah, so they're doing some flights based on immigration status. All of these people were already in the immigration pipeline. And so we're helping them get out, and in the interim supporting with some food.
So now that's taken care of. You got bored and you moved on to the Ukraine. Is that right?
You know, so it's funny. I met these Allied Extract guys who just, as someone else described them, know their shit A to Z.
Yeah,
right?
Good. Yeah.
I met them during the Afghan evac situation, and they were doing their own thing. They were doing their own evacuations. They formed initially to get their own interpreters out. You know, people they knew personally, or 1 degree of separation only.
Right. Thank you.
And also assisted some more official agencies and extractions.
Yep.
And so I met them because we were both trying to get the same United States citizen and her son out. And so
oh, really?
Yeah, she had contacted me, and I very easily just got her on a plane with Argo.
So they were having trouble, and then here comes PA Lydia.
You know, they weren't having trouble. They would have done it many, many times over. She was giving them trouble, but needed some extra conditions met.
So they I see.
So essentially, she wanted more family members out. Yeah. Right? She was kind of she's worried for her elderly mom, right? And things like that. So Allied Extract certainly could have done it, but I kind of snuck in.
They got the peanut butter jar. They got the lid started, and you finished opening it.
Yeah.
Well, it's good that that you're saying that you said that they would have taken care of it, because we have Brad Genero, who from LYDIExtract.org on the phone right now. Brad, thanks for being on Weird Medicine.
Thanks for having me.
So, this is awesome. So tell us, we're goofing around. Obviously, you guys are doing amazing work, and you were doing amazing work in Afghanistan and now in the Ukraine. So tell us a little bit about why NGOs have to be there and what you guys are doing. And I'll just ask all my questions up front, obviously, and we'll get to how people can help you. But give us the scoop. What's going on the ground there?
Yeah, I mean, what's going on the ground is very fast moving. It changes day to day and hour by hour. So there are a lot of NGOs, but not a lot of them actually have access into the Ukraine. It's better now, but initially it was incredibly difficult and dangerous. So what we do, we're pretty nimble, we're very small, and we're very well networked. So what Allied Extract has been able to do is kind of energize a network that we had in the surrounding countries and in Ukraine, and we were able to acquire all kinds of different stuff, whether it was food or medical supplies, and get it to one of our people on the border, who then was able to transfer it all the way into some of the hardest hit places in the Ukraine.
Yeah. Yeah, it says here in Ukraine we send convoys into besieged cities. And I'm looking, oh, my good Lord. So where do you get all these supplies from? Obviously, they're not coming from the United States. You must be getting them from other places in Europe. But how do these things get to the border, and then how do you get them across the border to people who need them?
Yeah, I'll give you the details that I can on that.
Yes, understood.
So, yeah, we basically what we do is we raise money. The money is transferred to contacts that we have both in Romania and in Poland. They're able to do the purchasing of a lot of this stuff, surprisingly, and from there they box it up and they transport it to a border link up where our Ukrainian contact then picks it up and does a very difficult job of delivering it to the site. Wow. And that could, be overnight, or it could take days, or one of the drivers was just stuck somewhere for, I think, 3 days because they were under bombardment. But, it's not easy, but it works.
Wow. So are you all using internet in the Ukraine, and how much did Elon Musk help in that regard? Because I thought that was a cool story.
Yeah, it's very cool, but they can't triangulate the positions that. So our contacts in the Ukraine, they leave their cell phone and devices off until they're in a secured area near the border.
Yeah. Good Lord. Okay, this is amazing. PA LYDIA has brought us another amazing project. How can people help? I mean, everybody wants to help. They don't know what to do, and they don't know whom to send money.
The best way to help is, first of all, like I said, we're small. We need funds basically to make this happen. We don't have any paid positions, so everything that's generated goes directly towards supporting these people in the Ukraine. And we focus on humanitarian aid. There's enough big countries that are shipping all kinds of weapons and things like that. We don't need to be involved in that side. So our focus is on helping the people that are victimized by this horrible thing.
Sure. Well, I would think that if you were dealing in arms and things like that, that would make you a target. Are you a target giving humanitarian aid in this country? Can I ask you that?
I think anybody's a target. If as the Russians are withdrawing, the atrocities that are being uncovered are pretty bad. So I think anybody is fair game and a target if you get into one of these kinetic zones.
So food, medical supplies as well, and what's going on the ground with trying to deliver medical care to people? You got pregnant women, you got kids with ear infections. I mean, how is that happening?
Yeah, so I mean, just because war happens doesn't mean the other medical conditions stop. Right. One of our first shipments actually included some medications and some equipment for mothers, expectant mothers. So I was a little surprised when I first saw that on the list, but that's legit.
Sure.
We basically get a wish list from our contacts in the Ukraine, and we do what we can to fill that order, and we get it to the border, and we try to get it done as quickly as possible. It can still take a week or 2 weeks to get a shippable package ready.
Okay.
But
I think it's awesome that you're kind of taking orders, because I've been involved in some of these disaster relief before. Mostly, people are going to laugh at me through ham radio and stuff like that. But what we would find is we would get tons and tons of water. It's like we don't need water anymore. We've got more water than we need. So I like this sort of just-in-time sort of thing where, they can tell you what they need and you guys try to get it to them. This whole system of disaster relief has improved, by quantum leaps since I first got involved with this kind of stuff back in the 70s. It's amazing. That's not really a question.
Yeah, we're pretty fortunate. We've got a pretty talented group of people involved with Allied Extract, and these guys are experienced. It's quite an honor to be rubbing elbows with these guys.
Yeah.
So
Allied Extract.
We try to do things a little bit differently.
Allied, that's awesome, man. And we're I'm so excited. I'm running out of things to say. I'm just kind of blown away, to be honest with you. Let me give out your websites, LYDIA.extract.org. And I'm just going to make this commitment right now that Weird Medicine's going to donate $1,000 as soon as we get off the phone, just to maybe we can get some of our listeners to do a little bit of this as well.
That will sponsor an entire convoy. And what's also really
cool,
is fantastic. What's also really cool about Allied Extract is that you can trace your dollar, like you can trace your donation.
What?
Like we get pictures on the ground of people as they receive our shipments.
Wow.
Right. And so maybe we could put like Weird Medicine on one of the boxes.
No,
right?
Please don't do that.
Should we not? Because we can.
Really?
Right? Yeah.
Get out of
Brad,
here.
don't you think that's something we could probably do?
No,
We have absolutely.
Yeah, we can do it, and that'll be a great post.
We're not
for you.
doing this to market our
I know,
radio
but
show.
it stimulates people to donate, and it's nice to see where your dollars go, right?
Okay.
Because if you donate to a larger organization, especially one with that has more overhead than us, right? Maybe somebody's getting a salary, something like that. You don't always see where your donation goes.
We won't name any of them, but it might rhyme with, I don't know, Schmidt,
Boss.
Schmoss, or something like that. Yeah.
Yeah.
I'm with you.
And I like
also a worthy organization. I'm just being silly.
Yeah, and this was a little bit random for me because I was helping a little bit with evacuating some people through in-laws from Ukraine and other people who needed to get out of Ukraine, right? And so I got a call from these guys saying, hey, can you be on our board, our secretary? I'm like, okay, what's the commitment here? Well, maybe an hour a month. I'm like, okay.
Oh, sure.
Yeah,
right.
Okay. It's not happening. However, I'm super proud to be a part of them. Super diverse things we can do. You could even sponsor like a restaurant that's feeding the civilians for a day.
Really?
Okay, so $700 a day. This one restaurant's cranking out 1,000 meals, feeding the soldiers and civilians there. So we have a lot of different projects that you could get involved in. There is some flexibility where your donation could go. So alliedextract.org, you can see my face.
Really?
Yeah, my photo's on there.
I don't
Brad's
see it.
photo is on there if you keep scrolling down on the homepage. So if we ever do a date-a-thon, you could just check me out on alliedextract.org.
Okay. We don't want to talk about your dating life
I'm joking.
When we're talking about helping people in the Ukraine. Oh, there you are.
Yeah, see? And from there,
Director of Development.
You can, a fancy word for you can't say that you're the secretary, Lydia.
Got it.
But you can shoot me an email. My email's on there if you want to collaborate on a special
project.
Look
at Brad. So. Now that is a real man right there.
Yeah, with the flag behind him and
that
everything.
Is awesome. Look at that dude. 22-year U.S. Navy Seabee. Wow, thank you for your service to your country and now in this regard. Thank you. Goodness gracious.
Yeah, my honor. Yeah, that was Mustache March, by the way.
Yeah, okay. Yeah, you don't. Whatever. That's awesome, man. Thank you. And he's got a background in getting it done. I can tell. That's fantastic.
Cool.
I'm very proud of you guys.
And
as soon as we get off, we'll get that money to you guys. And
thank you.
Hopefully, our Weird Medicine listeners. We've got listeners on the podcast side. And also on our Patreon, we'll put some, a link up there. But we get the biggest number of listeners on the Sirius XM show.
Cool.
So we'll see if, and what we'll do, I'll tell you what, on the pad data, See, here now I'm telling you all these things I'm going to do. Look at me.
I appreciate
Look at me.
you.
Look at what I'm doing. But we'll put it on the pad data. That'll be the title of the show this time, so that if anyone's listening to the show, they will see the URL for the website scrolling across their screen.
Thank you
okay?
very much.
Awesome. Okay. Well, listen, Brad, you got anything else to tell us about this? I think, it's just an amazing thing, and I'm very excited to have you on. And I'm just babbling. So what else you got? And if nothing else, then Godspeed, sir.
Well, keep an eye on the website, because we do have some potential projects that we're trying to spin up. Lydia talked about one, and we've got a couple others that are cooking. So some pretty cool stuff, much needed. Just keep checking the website. And
we're not forgetting about Afghanistan, right? But the State Department's actually a partner with that now, so that's great. It's great to hear. All right.
Yeah, they're trickling out. They're coming out though.
Okay, good. Brad Genero from AlliedExtract.org. Thank you so much for being here. Thank you again for your service, not only in the military but in this endeavor as well. It's awesome.
Well, thank you very much.
All right, thanks, man.
Take care, Brad.
All right.
All right.
Wow.
How about that?
Cool.
Incredible.
Yeah, I love it.
Really, I usually have a million questions for people, but I got so kind of overwhelmed with looking at this website and the stuff that they're doing.
Cool.
I almost had to stop for a second.
Yeah.
Because I was getting way, way, way ahead of myself. I was hyperventilating all kinds of stuff.
No, it's a cool group, and it's small. It's like if I ever go backpacking somewhere and get kidnapped, could you guys please call Allied Extract
yes,
for
of
me?
course.
That would be great, because the whole goal is we're long term, right? Rebuild, move to the next place in the world, and help.
Okay,
so,
awesome.
Cool. Thank you, guys.
Yeah, thank you. So you brought some weird medicine stuff too,
Heck
right?
yeah.
Okay.
Yeah.
This woman, I'm telling you, if we ever do dial a date with you, that's going to be hard to keep.
Uh-oh.
We're going to have to get the really quality dudes, because she's the real deal.
Dude, post midlife crisis, please.
Yes, of course.
Yeah, thank you.
Yeah, but then you get into the end of life crisis guys.
Widowers.
Well, I mean, I'm just saying,
Pre-widower.
end of life crisis. So the midlife crisis is, oh my God, I'm never going to be able to, date again or all this stuff. So then they start dating, and then, and a lot of times they're married, and that doesn't work out very well. And then you get the guys who are at the end of their life. They say, oh shit, I'm never going to be able to have intercourse of any kind because I'm going to be dead. And then they start going crazy.
Yeah.
That would be me.
That's a
I'm
great
not saying,
topic for a show.
Yeah.
All of the different things.
Yes.
Right?
Well, we can talk about
Injections.
Yeah.
Implants.
Oh yeah.
Yeah.
Oh yeah.
Well,
show. We have done.
That's that's our weekly topic.
We've done 17 years of shows. You have not been listening that long.
I googled the topic that I wanted to discuss.
Okay.
In addition to the tag weird medicine, and I couldn't find it, but you did mention that you guys had discussed it before.
Well, let's go. It doesn't, us repeating ourselves is not that big of a surprise to our listeners, and we usually try to do a slightly different take each time. So what do you got?
Yeah, so I'm thinking for like the broad application, broad audience, and something that utterly disgusts me.
Excellent.
Right? And something that I decided to test myself by sitting in my basement and YouTubing videos of, just to make sure that I've gagged a little bit, and I did.
So your husband is on YouTube? Sorry.
Oh yeah.
Well, he listens to the show, so.
Oh, does he? Okay, sorry.
I'm just kidding. I'm just kidding. No, tonsil stones.
I was only halfway kidding.
Hey, if you want to make him miserable,
hence the reason.
I could give my ex-wife's phone number.
Hence the reason we're going to be doing Dial-A-Date down the road. But anyway.
Tonsil stones.
Enough about your personal life, Lydia.
Tonsil stones.
Okay, tonsil stones.
Disgusting. Yes. Tonsilliths.
Yes.
Right, lith from the Greek meaning stone.
That's right.
Give yourself a bill.
Yeah.
Yes, we used to do tonsilliths a lot in the beginning.
Okay.
And but it's been a long time, so let's talk about them. And you describe them, because if it makes you gag, it'll be more fun.
Yes.
Yeah, I've been training my gag reflex to not be on the radio, so we will try. So Yeah, our tonsils, right, are lymph tissue in our oropharynx.
Yes.
Part of the ring of lymph tissue at the back of our throat. And both the pharyngeal tonsils, the ones you can see when you open your mouth and look in the mirror and say, ah, and our lingual tonsils, the ones beneath our tongue, they have nice big crypts, sometimes large crypts.
Right.
And they collect bacteria, lymph debris, so white blood cell debris, and that can calcify into stones and contribute to halitosis or bad breath.
Yes. Very good.
Or a bit of pain or discomfort when swallowing.
A lot of adults don't have tonsils anymore. They've just atrophied or they had them removed. But those that do, a lot of times, these pockets or crypts, not crypts, but, people think we're, wearing red or versus blue, you can go get in trouble.
I think crypts are blue.
I was thinking crepes like that you would eat, like the French crepes.
Crepes. You got tonsillar crepes.
There you go.
That wouldn't be very tasty.
No, they're awful.
If you're in, if it's in a pinch, you might eat a tonsillar crepe. What I hear. But anyway, so yes, and these pockets, you're just eating and you're just forcing food particles in there, and then the body is like, wait a minute, this is food and it's rotting, we need to do something about it. So white blood cells and fibroblasts, the cells that make fibrous stuff, will invade, and then these things get walled off. So whatever's in there is most of the time is walled off, and when you pick one out, it's like plastic until you mash it, and then it will stink to high heaven.
Because of the volatile sulfur compounds found within.
Give yourself a bill!
Yeah, so...
Smell like a swamp.
Yep. Or an abscess. All those things kind of have a similar smell. That just sort of rotting protein. So in your research, did you come across anything that you could do to treat those if you have them, besides scraping them out,
sticking your finger and pressing on your tonsil?
You can use a tongue depressor too.
Yeah, or a water pick.
There you go. That's the one I'm thinking.
Do a water pick. Rinsing with a nice purple mouthwash to also help you prevent cavities, right? And specifically spitting it out and not swallowing it.
Yeah, don't swallow that.
Yeah. No. I thought it was interesting that that's one of the only indications for tonsillectomy in the setting of halitosis.
Well, if you have tonsillits,
so repeated tonsillits in an adult patient with halitosis, and that's only 3% of patients.
Because that's right. Because usually bad breath is caused by, Dr. Scott,
rotten gums and teeth.
There you go. So periodontal disease, dental disease, dry mouth. People have dry mouth.
3% are caused by attributable tonsillitis. Yeah. So,
very excited about that.
I thought back. You need to pause.
Nope.
So I thought back to this patient that I had one time who came in for sore throat, and I thought it was quite widely applicable, especially as we're entering the season of spring, right, and allergies and perhaps a bit of lymph flare. Where these things might spur for people. So someone came in and had repeated episodes of this very mild pharyngitis or throat inflammation, kind of painful swallowing. It was a younger person who still had their tonsils. They were not atrophied. And I noticed really large crypts, right? And so I decided to take a cotton-tipped swab.
Oh, no.
Fancy word for a Q-tip that costs probably $5?
Okay, there we go.
And so I just poked it. I just gently applied pressure to the tonsil, and they all just opened with these large, up to 1 centimeter tonsillits popping out, looking like a honeycomb.
That's good eating, I'll tell you that.
And they fell out on his tongue. Good stuff. He gagged, I gagged. We were all just gagging, but it was the reason for his repeated presentations of sore throat. Yeah.
I was trying to find. Okay, here you go. Listen to this phone call. This is the best phone call we've ever had, and it is apropos to this, and people who listen to the show are going to know exactly what I'm going to play.
Hey, Dr. Steve. My name is Dee. I'm in Nashville, Tennessee. I am calling because you said something about a worse medical smell. I was sitting in with the dentist one day. A man came in. His jaw was swollen. The doctor had a round probe, was moving his jaw out of the way. The probe brushed up against whatever the lesion was inside of his mouth, and some shit came out of it that looked like green peas, like pea soup. And the smell was so nauseatingly bad that I quit school, and I am a realtor now. I'm not doing anything in the medical profession because that smell was just like,
That's my favorite, because it's one thing that she described the color and the consistency of the stuff and how bad it smelled, but it was so bad that she changed careers to a completely non-medical career, and she's selling real estate.
Oh, man.
Now, Dee's been here in this studio. We had a contest about the best phone call. We had a bunch of good ones, and when she won, we just sort of made contact with her, and so she is one of my going to be one of our guides when we go in May to Nashville and take us around to the hot chicken places and stuff like that. Yeah, so
jealous.
She knows the good places to go. Anyway, Dee from
I just watched a
she's
video
one of my
on
favorite
somebody
people.
making hot chicken, Nashville hot chicken. It looked so good.
And it probably was somebody not from Nashville, I'm guessing.
They, because
I saw Sam, the cooking guy, making Nashville. It's like, Sam, you don't have any credibility on this.
This guy, I don't know where he was from. He lived in a shack, like a really tiny place.
Okay.
He swirled some water in a dirty dish and then made it in that. But boy, it looked good.
Yeah.
I would definitely go on a hot chicken tour.
Yeah. I'm very excited about that.
Exciting.
And that is in May for the Who Are These Podcasts live event in Nashville. It's May 14th. It's in the afternoon, and then there will be a comedy show that evening. And if you're interested if you come to that and you come say hello to me, I'll buy you a beer as long as you're allowed to drink. And it's at watplive.com. Go check that out and come hang out with us.
Very cool.
I'm trying to get Dr. Scott to go with. The other person that does the Myrtle Manus voice is going.
I'm in. I love Nashville.
Yeah, he'll be there.
I love
and
Nashville.
we'll be talking like this the whole time. And oh, God.
Yes.
So that part won't be fun, but everything else will be fun.
Yes.
Very
So
cool.
anyway, that'll be fun.
Music City, baby.
So yeah, tonsilliths.
Hey, I do have a quick question.
I was just going to throw the other thing. Did you look up the other thing I told you to look up?
I Google imaged it, and I knew what you were saying. I actually had a student with me. And I said, what do you think this means?
Yeah, so she said, tonsilliths make me gag. And I said, well, Google tonsillar myiasis. So people who have been listening a long time kind of know where we're going with this, because we've done oral myiasis before. And this is a subset of oral myiasis. It's MYIASIS. If anybody, I'm just telling everybody, don't Google image this. I'm warning you, don't Google image it.
Do it.
But it's MYIASIS. But don't Google image it. Anyway, so you did, and what happened?
We had a nice discussion, and she left shortly thereafter. It was her last day.
Did you gag?
I did. Whew! There's a good one there.
Yep.
Missing a mandible.
So oral or tonsillar myiasis is when you have usually dead tissue in the mouth, and you sleep outside with your mouth open, and flies fly into your mouth, lay eggs, and then you still don't do anything about it, and then the eggs hatch, and then you get maggots cleaning the tissue up for you. They're doing you a favor. They're
helping a brother out.
They're helping. Oh, jeez, Lydia.
I have it pulled. I do have the image.
Oh boy! Yay!
Yeah,
we got a gagger back.
I've got the Google images pulled.
We haven't had a gagger in here since GVAC passed away, and so
GVAC took his
very excited.
His exit. Just don't puke yet. We've got a question.
Puke.
We got a question.
Okay, go.
Yeah, from the we have two from the chat room, but
I now understand though. We're putting a monitor up there, so that I can cast images over there, so we can all see what we're looking at. if Lydia's its stomach is this sensitive.
Lord, poor thing.
Sensitive.
We will have lots of fun.
Poor thing. All right, movie Messiah. Okay. How do you check to see if you have these stones?
Oh, that's a good one. You want to take it?
Yeah,
Lydia can take it.
Yeah.
Well, you could.
Can you talk?
If she can.
I can.
Okay.
I closed it. I closed it.
I can fix it, by the way.
I'm used to trying to save face, especially in front of patients when I'm gagging. Masks are nice, though. Masks really help hide.
Unless you're puking and it's shooting out from all four corners of the mask.
Yes. Like a projectile vomit.
I have to tell you my my furuncle story then.
Ooh.
But go ahead. So anyway.
Okay. So, one thing you could do is get a light, right? Get a light, your cell phone flashlight, and stand in front of a mirror, take a peek into the back of your throat.
It's hard to get it lined up just right, but you can do it if you try.
Yeah. And just see if you see big crypts or white spots on your tonsil, as long as you're not having extreme pain or fever, right? Inability to swallow or swelling of your soft palate, or it looks like your mouth looks asymmetrical.
Don't go poking that.
If you're not in dire straits, you could always stick a cotton-tipped swab, like a Q-tip, or your finger back there. Apply some very gentle pressure.
Your primary care provider could look at there and say, yes, you have tonsillar crypts. And one thing I was going to tell you about is people think a water pick, this big giant thing with a tank, and it is a pain in the ass. Everybody buys a water pick and then everybody throws it away. They have new ones now that are you fill up a reservoir and they're wireless, and then you just hold it and you put your mouth over the sink and then you do the water pick, and it doesn't last very long. It doesn't hold as much water, but it is the greatest thing in the world. I brush my teeth. I've got these stupid Invisaligns, right? And they put these anchors on there, and the anchors, I guess, are catching more food particles. I don't know what's going on, but I'll brush my teeth for 3 minutes, and then I use the water flosser, and it's tons of stuff still comes out. It's amazing.
I've never seen one of those.
So yeah, it's handheld and it holds a small amount of water, but it lasts about a minute, and that's usually enough to floss your teeth.
Well, that's cool.
So and you could use one of those for this.
Yeah, absolutely.
But I would now. Lydia brought up something that's really important. If one side or both, but if one side is huge, it's pushing across the midline, you don't want to go in there and poke around. Why? Do you know what that's called?
Well, you could get a paratonsillar abscess or have a paratonsillar
there
abscess.
You go.
Give yourself a bill.
Because green shit's going to go everywhere.
It's worse than that.
Get in your bloodstream.
Yeah.
Go to your brain.
A tonsillar abscess that's a surgical emergency. And the other thing is that you don't know that that's really a tonsillar abscess if you're not a medical professional, because I've heard of this happening. Someone thought that they had a tonsillar abscess, and this was done in a physician's office that was not an ear, nose, and throat doctor that shouldn't have been messing with it, but the patient came in and they had a tonsil that was crossing the midline, and they went to poke around in it. They weren't trying to do an incision and drainage. They were just poking around, and it wasn't a tonsillar abscess. It was a carotid aneurysm, and it bled, and that's the end of you.
Yeah, bye.
So if you look in there and your tonsil is crossing the midline of your mouth, go see a physician, and one that knows what they're doing.
Right,
Good.
and because tonsils are lymph tissue, we can also see lymphoma of the tonsil.
Yes.
Right, so certainly if you're having significant trouble.
Well, now everyone that's looking in their mouth and seeing some enlargement going, I've got lymphoma.
Well, we will drive up a lot of doctor visits.
There you go. But
I'm just kidding.
Just let your primary
The vast majority,
I
think over 10% of people have tonsil stones. It's not like 80% or something like that.
Right.
Peaks at puberty and young adulthood.
Yep.
So.
And they're nasty.
I got a real quick question from Bob if you want one.
Yep, of course.
From Bob. Here we go, Bob. My PCP took leave from her clinic with no indication of if or when she would be back. I found her on Facebook. Is it unprofessional to message her there and find out what's going on?
Okay, so it's unprofessional for your primary care provider to message you. It's not necessarily it's not unprofessional for you because you don't have a professional relationship with them. You have a a provider-client relationship with them. If someone messaged me on Facebook, I can't really message them back, but I could refer that to my office and have them call.
Right.
So, if as a patient, found me on there. What do you think? You were nodding your head pretty vigorously.
It's a difficult situation, at least in my profession, right? With oncology,
right.
You become a bit of a
but
friend.
But if you've abandoned your patients, I'm
Just
not
ridiculous.
saying this person did.
It's ridiculous. I think I probably wouldn't bother reaching out to them, honestly.
Yeah.
Like, maybe their spouse died. That happens sometimes.
Or they're just, they've abandoned their patients. And
I can't imagine doing it ever.
Yeah.
Right? Through the hardest time in my life thus far, I haven't missed a day of work.
Right.
So,
but if you were going to, you would arrange for follow-up. So
absolutely.
this is what I'm wondering.
They wouldn't be in your position, Bob.
If this person is gone, they're almost all the time they're going to have made arrangements for somebody to take their patients. So you can call the number, and I'll tell you what, email me and let me know something about it, and I'll see if I can find out who's covering for that person. Good. Sometimes a physician can make inroads in a situation like that. I mean, I can call the emergency room, say, who's covering for Dr. So-and-so?
Yeah.
And absolutely. I would do that and then let you know who that is and give you their number. But it's not unprofessional in the sense that, so let's say your doctor thought you were hot, Bob. It would be very unprofessional for them to reach out to you through Facebook, okay? And
Ethics committee.
That's right. I think you're hot, and all that stuff. But going the other direction, it's not unprofessional. It's a little weird, but we live in a weird world. It's 2022, but I don't know that they would respond to you. Maybe they would, maybe they wouldn't. But like Lydia said, we don't know what their situation is. It could be a tragedy, and you're like, well, can I have my, beta blocker or whatever? But you need your maintenance meds, so we got to find you a primary care provider somehow. And but that's usually the protocol is to just call the office. And I'm guessing Bob's not stupid, so he already tried that and didn't get a good answer. But that would be normally you can call up and say who's covering for Dr. So-and-so now that they're gone. It is unusual for somebody to just abscond, but it happens sometimes, and then you got to find another primary care provider.
Move on.
And it's got to be something major on their side, right? We all take the oath, physicians specifically take the oath to do no harm and be there for patients.
Wait, you don't take that oath?
We take a modified oath for PAs. It's not exactly the same. I Googled this one time. It's not precisely the same as the Hippocratic oath.
Our Hippocratic oath had all kinds of ifs, ands, and clauses built into it when we did it.
So essentially, I'm saying probably more than likely there's something major tragic going on with this person.
I would think so. Yeah. But if you want, Bob, feel free to email me. Just go to drsteve.com, click contact, ignore the warnings. Those warnings are not for you guys. That's for the general public that happens to run across my website, our website. And if you give me the city you're in and the provider's name, I'll see if I can find out what's going on. I'm happy to do stuff like that.
It's pretty cool.
Well, it's not. I don't think it's that cool.
I think it's cool.
It's something we can do. That's something I can do. I can't write our patients, our listeners, prescriptions and stuff like that. But this I can do. Anyway. All right. Cool. You got anything else over there, Scott?
No, sir. That's all of.
Did you have anything other than tonsillitis? PA Lydia?
Well, I thought someone recently told me that they had trypophobia.
Oh.
So I started reading about it, and I thought, man, do I have trypophobia? Because of this recurring flashback I have from these tonsillitis popping out of this person.
Oh, you don't like irregular clusters, and there are these weird plants that freak people out.
Pod.
Yes, very good. Yeah, and it freaks people out.
Yeah. And they used to think, so trypophobia is
tell people what it is. That's
kind
excellent.
of this revulsion to clusters of holes, right? And it usually triggers a very disgust response.
Right.
Vomiting, nausea, just wanting to look away. Unlike fear, very separate from a phobia that triggers fear.
Right. This is more of a revulsion.
Yeah. So think like bubbles in the top of your coffee. We should have given a trigger warning. I'm about to describe
this
so
whole
many
show
things.
is a one big trigger warning. But I'm going to Google image it. If you want to know if you have trypophobia or trypophobia, just Google image it and see. And these, I'm kind of grossed out by this. But then it's got like strawberries.
Yeah, so someone could have. Oh, yeah. Yeah, see,
Are you looking at some?
I think I have it.
Yeah.
But strawberries don't. Strawberries don't gross me out as much.
They gross me out in the context of this. And then here's one. Here's.
Okay, I'm gonna close
Sorry.
it.
There's pictures of bread.
Yeah,
and that
the bubbles or the cracked bubbles in bread or popped bubbles in bread.
But then there's people. They've got these pictures of people with these things that are not physiologic. You know, they're just
photoshopped.
They're photoshopped.
Yeah.
But yeah, that's pretty creepy.
Thought it was a good link between your what was it, myiasis or tonsillar myiasis, because
the fly eye.
They used to think that trypophobia was related to being afraid of venomous things or things that would harm you, right? Like patterns on snakes, spider eyes are in a cluster.
Well, have you ever heard of botfly?
Botfly makes a similar appearance.
Let's tell people what we're talking about, though, when the botflies.
Could you do that for me?
Okay, I'll do that. This is where, in certain countries where these botflies are, if you don't wash your clothes properly and put them on, they can have botfly eggs or larvae in them, and they can burrow under the skin, and you get what looks like an abscess, but there's actually there's a living maggot, botfly maggot. They call them botfly larvae, but they're giant maggots that live under your skin. And I wonder if things like that, because itching, formication is thought to be a response to our ancestors who had to deal with fleas and lice and other parasites on under their fur, and there wasn't anything they could do about it. So they would pick it off each other and stuff like that, and you get that itchy feeling. And so that may be where some of these itching disorders come from. Go ahead.
Yeah, no, well, you're just like, we're just really vibing today, right? Because they used to think that this trypophobia was a natural instinct to avoid danger.
Yeah.
Right, so like the spider eyes and venomous creatures that have all of these recurring patterns, like a king cobra snake. And so this guy did back in 2017, this guy did a study where he took 300 people from trypophobia support groups and 300...
Wait, there's support groups for people who don't like looking at strawberries?
There are.
I'm sorry.
This is a real disorder.
Okay.
And I think I have it.
Well, I don't want to minimize it. I just didn't imagine there were support groups for this.
There are. So at least he found 300 people, right, that identify as having trypophobia.
Okay,
that, and then 300 of the control group, which was university students who did not identify, okay? Then he showed them 8 images of parasitic infections that had a circular appearance, right? So the botfly infestation, abscesses and furuncles have oftentimes circular, like tracts.
Sure.
That will appear in the skin. And then 8 pictures of things like strawberries or holes drilled in bricks, things like that. So the people with trypophobia had the same reaction to both images, which was that of disgust.
But the other people only were disgusted by the things they should be disgusted by.
Which kind of took us away from trypophobia being this innate avoidance of fearful and venomous things, more toward an innate avoidance of parasitic infections. Bacterial infections, things like that. So the thought is that there's some link toward anxiety of being just being anxious about parasites, right, and other infections. So it was neat. I thought this was all a great link.
Yeah, honeycombs is another one.
Yep.
If you look at honeycombs, it bugs you?
It does now. Now that I'm looking at it together with everything else.
It's together with everything else. See, the strawberry kind of creeped me out.
Yeah,
just because it was lumped in with these weird sort of things growing out of people's feet.
There you go.
Thank you for doing that into the mic so people know what's going on. No, I'm actually serious. I would be disturbed if you.
Sorry, I'm gonna close my iPad. Okay.
It's okay. I need to introduce you to Bobby Kelly. Bobby Kelly used to puke on demand on Opie and Anthony every time he'd come in there. And they had Pat from Moonachie. he went out to puke one time. They showed him some picture of some damn thing, and he went out, and Pat from Moonachie took a picture of his asshole, and they put on Bobby's phone. And there is, if you can YouTube this, it's called YouTube. It's on YouTube. It's called Bobby Kelly Pukes by Nelson. It's one of my favorite animations. And he comes back in, and they kept doing things to try to get him to look at the picture on his phone, and they couldn't do it. And Norton was just, he was trying everything. And finally, you knew that he did it because all of a sudden you hear like that, and then you hear, it's so great, and everybody laughing is the funniest thing. So hearing people puke, as long as it's not you, it's funny. So it's
yeah.
okay.
My brother would always pretend to hawk a loogie, because he knew that would make me gag. I mean, my friends can just make me gag on demand.
Oh, we're gonna have so much fun.
Yeah, sounds great.
All right, let's see here. You want to take some phone calls? We've got a couple of minutes left.
Number one thing. Don't take advice from some asshole on the radio.
All right. Let's see. I've got this one. Let me see. Oh, damn it. Hang it. Here we go. Sorry.
Hey, Dr. Steve. Long-time listener, first-time caller.
Hey, man.
And hello, anybody you have in the office.
Hey. Thank you, sir.
How long does someone have to abuse cocaine before it's a medical problem?
Wow, that's a great question. So we are medical professionals, so we can't condone the abuse of any street drug, right? But speaking from a psychological and sort of a addictionology standpoint, it varies. It's just like alcohol, right? Some people can drink their whole life and not have a problem, and then we have some people who are 40 years old that die of cirrhosis because of their drinking. So you first have to define problem, and that's the harder part. If it's interfering with your work, if it's interfering with your life, if you're craving it, if you're lying, cheating, and stealing, that's a problem. How long does that take? I don't know. You want to take that risk? That's the thing. So
you don't know how addicted you're going to be.
Other medical problems, right?
Yeah, and
that's the other thing.
There's the gingival retraction.
Yes.
Right.
Speak English for our listeners.
So cocaine is interesting, right? So we used to use cocaine for hemostasis.
Very interesting.
Not that I have personal knowledge, but we used to use it for hemostasis, right? Because it shrinks blood vessels or contracts blood vessels. So
hemostasis meaning to stop bleeding.
Yeah, which perhaps Ukraine could use. I'm just kidding.
I don't know.
Ukraine and cocaine.
All right.
I'm just kidding. Just delete.
That's your first boo.
So to start, I think they used to use cocaine in nosebleed control.
Yeah, and we used it in ear, nose, and throat lab when I was in medical school to dilate the tissues so we could look in each other's nose with a flexible fiber optic.
Thank you. Or something.
You're gonna boo me.
You're gonna boo me again. I'm gonna boo you.
No. I'm gonna boo myself. Yeah, flexible fiber optic scope, and so yeah, I mean there are real medical uses for cocaine.
Yeah, but in the period, and I don't know how many uses it requires, but eventually you could, if you're rubbing it on your gums, I don't know how you use your cocaine routinely, but it could cause gingival retraction, which would lead to shrinkage
of the gums,
dental loss.
Right, you got a dentist in there and you're just screaming, it's the shrinkage.
Hole in the septum.
Yes.
Right. Anytime you look up someone's nose, they have a hole in their septum. You're like,
the septum being that sort of plasticky thing that goes right down the middle that separates the right nostril from the left nostril.
Yeah. So eventually you would get a hole in your septum.
So you can get all kinds of things. Len Bias allegedly, used cocaine once and he died. So that's the problem. And then assuming that you're actually even getting cocaine, it could be lots of other things. So
fentanyl,
if this is all I'm going to say. If you think you have a problem with cocaine, just please get help. There's tons of places you can get help. If you don't know where to get help, go to drsteve.com, click contact, and we can, do a SAMHSA search and find a place near you that can help you. But there's no answer to that question that will do anybody any good. All right? Okie doke. Let's see here. John from Chicago. We can try this one. It's a little long. We're running out of time. I'll tell you what, John from Chicago, I'll get you next time. And, okay, here's a quick question from Gary from Buffalo. I'll try this one.
Hey, Dr. Steve. This is Gary from Buffalo calling.
Hey, Gary.
Been a long-time fan of yours, and
Thanks.
Your advice has been helpful. I just have a quick question. I'm 56 years old, obese. What's new, with your listeners?
Okay.
So, anyways, my question's about blood pressure. How come blood pressure goes up as you get older? Because my blood pressure, I am on medication.
We've got about a minute left. Lydia, you want to take that one?
No, go ahead.
No? Okay. Scott, you got anything on that? I do. Well, our
I slept through it.
Circulatory systems are just less elastic. How does blood pressure go up? I've always talked about imagining the circulatory system as being a closed system with a pump. You take a pump and put a hose on one end and plug it into the other end. How can you make the pressure go up and down? Well, one way that you can make the pressure go up is to clamp down on the hose, or make the caliber of the hose smaller. To increase the resistance, and that's basically a lot of it. The other thing is that the kidneys become less adept at moving your blood pressure up and down and keeping it in a normal place. Either they don't sense the blood pressure as well as they did, so they allow higher blood pressure to become to the forefront, or they are not secreting hormones properly to keep your blood vessels open, and so now they start to clamp down and increase the resistance. Anyway, that's a real thumbnail. Maybe we could bring this up next time.
Yeah.
But anyway, hey, listen, thanks for being with us, PA Lydia. Thanks for being here, Dr. Scott. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get off your whatever, and we'll see you next week. Whatever. Jesus. That's terrible. Maybe I should do that over again. That's it. Let me get that one right. I got to at least get that right. Okay, it's after I say Dr. Scott. Until next time, check your stupid nuts for lumps. It's recording on the wrong place. Fuck me. Okay, sorry. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. There you go. Take 20. All right? Very good.
Sounds good.
Want to do some podcast action?
Yeah.
Okay.
Thank you guys. That was awesome.
Yeah, it was fun.
Okay. Yeah.
I hope it was fun for the listeners. What do they think?
So far, so good.
Now, have you seen Cardiff Electric or Creep Off or any of those guys on there? Okay, because if you see them, we got a Tucker Dixon.
Nope.
Do they come on when there's a problem or what?
No. Well, Cardiff Electric owns our network, so we have to make sure that we pay attention to him when he's in there. All right, let's do some podcast.
What did the left ear say to the right ear? Nothing. They're just really good listeners. A guy named Herb once gave me some sage cooking advice, and I've been stewing on it ever since.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve, you'll take a cow for
From, oh shit, way too loud. From the world-famous Cardiff Electric Network studio. You know what? Carl's going to get mad at me. I'm going to have to redo that. Damn it. Okay, so it's been a week. I was off a week, and I'm so rusty. Sorry, everybody. Okay, let me see. There we go. Okay, you ready? Sorry, I won't screw up this time.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From God. Damn it. What is wrong with me? Now it's, why am I so low now?
I think it's getting close to the bedtime.
You think that's what it is?
Yeah.
I can't fix that. I have to do that over again. What in the hell? Okay, sorry everybody. One last time. Good God. Yeah, I know.
I'm good.
Okay. Let me just check levels on everything. Hello, test. Why am I so low now? Hello, test. Testing. 1, 2, 3, 4. That's what I did. I turned my headphones down. Okay.
Why can't you?
Someone has been up here. You know, we said that before.
Mm-hmm.
I got to talk to my house sitter's boyfriend. All right. Or I just have to mention. That could be it, too. Okay, here we go.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the godforsaken Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little bell, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
We also have the return of PA Lydia, everyone, and I'm very excited. Hello, PA Lydia.
Hello, hello.
And she's got a new crusade we're going to be talking about in a minute. This is a show for people who had never listened to a medical show on the radio or on the internet. If you have a question you're embarrassed to take to your regular medical provider or you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician, assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, massage therapist, or whatever. I almost thought for a second that we were going to be doing take number 14 on the intro. But hello, PA Lydia.
Hello.
Don't forget about stuff.drsteve.com, stuff.drsteve.com. We're still live with that, so I guess Amazon thought we were okay. PA Lydia, they sent me a letter saying that we weren't in compliance with their affiliate agreement, and I'm like, how in the hell is that? I haven't changed anything in the last 10 years, and we've been okay. So anyway.
You know Amazon. I'm just kidding. We love Amazon. We love Amazon.
Old Jeff Bezos, and second richest man in the world.
And in space, right?
Isn't that something? Yeah, and he's in outer space, too.
Yeah.
So isn't that crazy? I remember when Amazon first opened, and it's non-brick-and-mortar doors, and you just bought books. It was a bookstore. And now it's still a bookstore, but it's, it's like if I'm going to buy something and I just need something for the house, what is my knee jerk is I go to, I just, okay, well, let's see if Amazon got it. And they almost always do. Yeah. So check out stuff.drsteve.com. What I couldn't find, by the way, and was when we were in Florida this time, I stayed at a place called the Beach House Suites by the Don Cesar. So it wasn't, don't get all highfalutin or thinking I'm highfalutin. And we weren't at the Don Cesar. But we were at the Beach House Suites at Don Cesar, and we became very friendly with our bartenders, Chris and Portia. And as a matter of fact, on Wednesday, Tacey and I made a concerted effort that we were going to sit at the corner of this little sort of, it's a bar, and sit there all GD day. And that's what we did. It was one of the nicest days I've ever had on vacation because I didn't feel like I had to. And
you didn't feel like you were entertaining everybody the whole time.
That is true.
Yeah, and normally Dr. Steve's in charge of all the entertainment.
And Liam usually goes with us, and he's in college. And I love my eldest, but he would have been every 5 minutes, can we play ping pong? Can we play ping pong? Can we play ping pong? Because he's obsessed with ping pong. And and he wasn't there, and Beck's just laid back. He's just cool. And so we just sat there all day long, to the point where people noticed it. I was sitting there because I go down there every morning to do work, and this one guy went by, and he said, yeah, I saw you and your wife just sitting there all day. And so anyway, but hello, Portia, and hello to Chris. But one thing, the reason I bring this up is that they had a sign that said, it had a seahorse, and it said, when life makes waves, enjoy the ride, or something like that. And I went to Amazon to get that because I thought it was cool to put it out back in the mini compound. I couldn't find it. It's the first time I've gone to Amazon, couldn't find something. So if anybody, this thing was on like a strip of like roofing steel. Corrugated steel.
I can have a guy make it for you.
Well,
he's got a special printer.
Oh, really?
Yeah, really, seriously, yeah.
Okay, I would love to
make it out of metal or copper.
Yeah. But anyway, if anybody knows where to find one, I couldn't find one anywhere.
It's going to be expensive. Hey, can I say a real quick word too?
Yeah.
This Saturday morning on CBS Morning News, a friend of mine that I play with every year when I go to Nashville, Brownman Keith Hines. She plays with Molly Tuttle. They're going to be on the CBS Saturday morning playing.
This coming Saturday?
This coming Saturday, yes. It'll be. You'll post this podcast.
What's the date?
It'll be the 6, 7, 8, 9, 4, 9.
4, 9?
Yeah, I think
Is
so.
that right?
This Saturday, I think so.
Okay. Yeah, all right. Yeah, we're recording this on the 6th, right?
So if you guys
Saturday
if you
night.
love some good music, and any of Dr. Steve.
What's her name? Bronwyn,
Keith Hines, yeah. And she's
Now,
the one that plays fiddle, that recording we did.
So are her parents hippies, or is she really from the UK somewhere?
She's really a hippie, yeah. She's a hell of a fiddle player. She's the one that played fiddle on it. You know when I made the bluegrass?
Everybody I've met that's named Bronwyn has been,
Well, yeah.
Either their parents were hippies or they were a hippie and they just took on that name.
She's for sure hippie.
Okay, that's cool. I'm not saying it's bad.
No, but she's got to be a hippie. Looks like it anyway.
Yeah. Good.
Talks
okay,
like
but she's a friend of yours?
Yeah, she's the one that played the fiddle on it. You know, when I did that bluegrass version of Weird Medicine, she's the one that played the fiddle and sang a little bit. Yeah, she's fabulous. That's her.
Where are those recordings? Did we ever play them
on
the show?
They're on your Apple. No, we haven't played them on the show yet. They're on your downstairs computer.
Okay.
We just need to mix them together.
Okay.
Yeah, she's fabulous.
Yeah. So tell the story. So you went to...
Yeah, it's called Nashville Acoustic Camps.
You went to a camp.
Yeah, and they allow...
And they didn't laugh at you.
They didn't laugh because they were
you paid them a lot of money,
and I paid them plenty of money.
Good.
No, I like to say I was accepted into the camp, but that helps when you have a checkbook.
Yeah. No, I don't laugh at you anymore because you've come a long freaking way through just simply the force of your will.
Yep. And I refuse to be awful. I mean, I don't mind being bad at something, but
I don't know about that. But
I refuse to be awful.
Yeah.
I just can't. I can't tolerate it. So that's why.
But with really no experience,
zero, none,
no talent,
no talent, no skills.
You've become actually, a fun musician to play with.
I can pick a little bit,
yeah.
Especially
and
the mandolin.
I have no talent. I mean, I'm terrible, so I'm saying that.
No, but they couldn't be more kind. But this Nashville Acoustic Camps, they started a thing two years ago called the a jam band camp. So it's a jam band kind of bluegrass camp.
Really,
very much in a flavor of say Green Sky bluegrass or
really.
Yeah,
I might like to do that.
Yeah, oh my God, so much you would totally love. And we have a whole bass section of learning how to play bass. And
really,
it's really pretty cool. Yeah, but Brownman's one of the instructors. They allow 15 novices, amateurs like myself.
Yeah.
And they put us in 3 groups of 5. One fiddle player, 1 mandolin player, 1 guitar player, 1.
Yeah.
If we got a dobro or bass or whatever.
Yeah.
And then we have at least 1 or 2 professional like Bronwyn. That's pretty awesome.
You gonna do this again?
Oh fuck yeah, man.
Well, I'm going. Let me go with you.
Oh, you would love it, dude. You would totally, and they would love you too.
Do you take your girlfriend with you?
Please
say no. I mean, not that I don't love her.
No,
I'm saying this could be a thing that you and I do.
I don't know. It's it's because it's I'll go over in the morning. We start playing in the morning, play all day, and then we play at night.
Oh yeah, our
you would love it.
Significant others would hate.
They would hate it. But Saturday night we play. We have like a dead hour or 2 or 3 depending on how long.
Really?
It goes.
And play Grateful Dead?
We all just play Grateful Dead songs.
I'm in.
Yeah.
All right. I wanted to make fun of you. I can't do it.
No, it's okay. I deserve it.
No, you don't. No, not for real. I mean, people who go. You know what? It's not. Nobody can listen to it anymore. But Semi-Sweet Melissa was the first time Scott ever
sang anything.
And it's the most god-awful thing
horrible.
you've ever heard.
You told what make her vomit. That would make her vomit.
And one time I tried to play it in here, and Scott, that's the only time he got
mad.
Were you mad?
No, I wasn't mad. I was just like...
He was just embarrassed, and he got up and left. And I'm like, okay, I won't play it.
Oh,
but you're good enough now that I think we should play the new version that you and I recorded, and then let people hear the original version.
Yeah.
Because G-Bac's playing was outstanding.
Yeah, I know.
And just because I think you're at that point now where you're good enough that it wouldn't upset you because people would see how far you've come.
Yeah, and now they can laugh and see.
Yeah, well, they could laugh with you rather than laughing at you.
Maybe, yeah, we'll get that. We'll break up the new recording and go from there. But
yeah, because I'm very proud of you actually.
Yeah, no, I appreciate it.
Yeah,
and you can tell from that first day I'm telling you, it was awful.
Oh, when you were there?
Oh my God, it's awful. But now, like I said,
but by the end of it, you got them. Okay, so the reason we brought this up is, well, first off, your friend is playing.
Yeah, Saturday morning. Yep.
Saturday morning.
Molly Tuttle. Yep.
On
CBS Saturday morning. It's
Saturday morning, not Sunday morning.
No, it's Saturday.
She didn't quite make it to the big
show. That was
show.
a good show.
No, the Saturday morning. Yeah, the Saturday morning is at the end of Saturday morning shows. They always have a chef. That they do a really cool kind of chef thing, and then they always finish it with a band. You're playing.
She's gonna be on there.
Yeah,
cool.
Yeah.
That's cool.
They'll
I'll
typically
watch
play
that.
3 songs. Oh, yeah,
I'll set my DVR and I'll watch it a year from now. But
Molly
I'll
Tuttle's the best flat picking guitarist you'll ever see.
And that's a woman. See, when I think
Molly can burn it up.
Okay.
Oh my gosh, unbelievable.
People say, well, of course, Molly's a woman, but there's one, the Molly Hatchet. That's what I was thinking of.
Yeah. You'll love this.
Bunch of dudes with crazy hair.
You'll love it, man. You'll love it.
Okay, cool.
Good stuff.
I'm excited.
Yeah.
All right, but the reason I brought it around to you playing was because you had them record something for this show and we never played it. So what was it they were doing?
So right before we
had them do a bluegrass
Lydia,
version of our theme song?
Right before I went, Lydia, Dr. Steve just out of the blue says, we need to do a different version of the theme song. I was like, that's kind of interesting because I like to write sometimes I like to write the little things we do. And I thought, geez, I'm going to be with world-class musicians.
He got world-class, I mean, for real.
For real class, yeah.
And who's the guy that sang?
Well, so
we got to play this next week. We cannot talk about this like this and not play it next week.
Yeah, and I actually heard Greg. On the radio yesterday, and Greg Cahill is in a Bluegrass Hall of Fame as a banjo player. They play for Special Consensus, but these guys are the real deal.
And they did
they did Weird Medicine. They were so wonderful. They were just so wonderful. So.
Well, check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. And please check out our Patreon. It's at patreon.com/weirdmedicine, where we've had Joe DeRosa on. We've had Bobby Kelly, Mark Norman. And very soon, we're going to have Mr. James Norton come on to talk to my wife about 90 Day Fiance. So I think it'll be funny because they're both just weirdly obsessed by that show. I think it'll be lots of fun. So, and we'll get Tacy to talk, and she's pretty funny when she's talking about it. I call it 90 Day Shit Show. But anyway, all right. Okay, so that's a longer intro than we normally do, but that's okay. Give the podcast. All right, and we can probably just end the show. Do we need to do another? Let me see if there's a good place.
I had one question.
Okay.
If you want one.
No, that's fine.
One.
That's fine. Let me see where I. Okay, so we can. What I'll do is I'll start out right there saying anyway. We could talk about that more if people are interested in it. Okay. All right. And then you have something?
Yeah, one from Colin. Yeah, Colin had actually a good one.
And, shit. Hang on. Sorry. I'm cursing in front of Lydia.
Potty
mouth Lydia.
EML.
Anyway, that's kind of just a Reader's Digest version of it. We could go into more depth. I still think that's, the physiology of fluid or fluid dynamics in the body is kind of interesting.
Sure, yeah.
But if you think of it as a closed system, you can kind of figure it out.
Yeah. Sorry I slept through the first part of that. Hey,
That's fine.
I woke up.
I don't blame you.
I woke up for a quick question from Colin Carnes.
Yeah.
What can cause cold extremities? Caffeine or stress cause it maybe?
Yes.
Or could an overall lower average body temperature cause it?
Interesting.
Yeah, so that's not a short answer, but we can make it kind of short.
No, we don't have to.
Yeah, we can make it short.
We have time. What else are you going to do? Lydia, you got anything on that? I've got an answer.
Yeah, I mean, I could ramble about a couple things.
Okay, we'll do it.
First thing you think
about what we do here is ramble.
Our temperature is very tightly regulated, right? We have homeostasis. So
homeostasis.
Rocking with a lower homeostasis, meaning
the body's ability to keep things kind of on an even keel.
Yeah.
That's an easy way to.
Yeah. So we aren't walking around with some people really cold, right, and others
like insanely cold, or people with a pH of 6 and other people with a pH of 9. That doesn't happen.
Which is why we need to talk about basic water on one of the shows.
We have talked about it. It's horse shit, but
totally.
But we could talk about that some more.
Homeostasis, yeah. So, having a lower body temperature, I don't think is really a viable reason to expect that you would have cold extremities.
Right.
Things like eating and kind of having increased blood supply directed toward your GI tract could sometimes cause colder extremities.
Couldn't do it. Okay,
there's a phenomenon called Raynaud's syndrome, which could cause colder extremities, which I'll let you talk about the pathophysiology of.
Okay, well, it's just what makes our extremities warm. It's blood.
Yeah.
So anything that will decrease the blood flow to the extremities will give you cold extremities. Some people, I tend to have colder extremities, particularly when I'm very active in the hospital. And if I shake somebody's hand, which we're not doing as much as we used to, when I did a lot, I got this, from people saying, "Oh, your hands are cold," and I go, "Well, cold hands,
warm heart,
big feet." But you know what they say. But yeah. So, but a lot of that is when I'm walking, there's really no reason for me to have cold extremities because you'd think I'd be pumping blood around to my extremities pretty efficiently, but apparently I don't, because the more active I am, the colder my extremities are. But caffeine is a vasoconstrictor, so that's one. Nicotine is another one. Things that open up the blood supply are things that increase nitric oxide, and so that would be things like Viagra and Cialis, but also the amino acid arginine can do that, can increase blood flow to the extremities supposedly. And then there are other medications that can do it, blood pressure medications and stuff. If you're on a blood pressure medication, if you were on a medication that to increase your blood pressure, that could also cause constriction of the extremities, because that's really how they work.
Adrenaline, right?
Yeah, adrenaline. Oh, that's why. That's why when I'm running around the hospital because I started with that, and it's like, I've got a good example, but then it doesn't make any sense. But yeah, so when I'm in the hospital and I'm working, my stress level is out the roof, and stress is cortisol, but also adrenaline. And when you have adrenaline, it's a vasoconstrictor, drives up your blood pressure and decreases blood flow to the extremities. But Lydia, I think, had the most subtle answer, which is if you eat, you're going to preferentially send blood to the GI tract. And that will draw blood away from the other parts of the body. Never the brain, though. The brain always gets all the blood it needs, plus and the coronary arteries. Those are the two big ones. But anyway, yeah, very good. Excellent.
Well, and if his temperature's low all the time, thyroid possibly. I mean, if he's got some temperature issues, possibly.
Give yourself a bill.
Yeah, I'll give Dr. Scott one of those.
The thyroid, the thermostat.
He made a little bit of a reference.
Thermostat.
If he had hypothyroidism, you could have generally low, and you would have cold intolerance, and you would have a slightly lower core body temperature. So you want to check your core body temperature. Easiest way to do that, rectal. Thank you. Rectal. Yes.
Oh, God. Potty mouth Lydia's back.
She said
we better stop the show.
Rectum nearly killed him. That's what we say in the holler, don't you?
Down there in the holler.
Yep.
All
right. Well, let's get out of here.
Let's get out of here.
Thanks. Always go to Dr. Scott. PA Lydia, another triumphant visit. We learned several things. That Lydia is an activist for people, and she's concerned about people all over the world that get stuck in places that they shouldn't get stuck in. So also we learned that she can look at pictures of bot flies and gag, and that's very entertaining.
She made her job a lot easier.
And also she brings really good stories.
Great
and
stories.
She is not afraid to bring us a story that will make her gag.
Yeah.
So I just got to,
No fear.
We like it.
Please,
Good job.
Commit.
So you're welcome anytime you want to come. And seriously, if you want to come every week, you keep this up. Hell, I won't.
He'll replace me.
No, she can replace me. I'm the boring one here. But anyway, thanks go Dr. Scott, P.A. Lydia. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, that Gould Girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Howdy Gooplunk, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, the St. Pete Barkeep Blower. P.A. Lydia, you hadn't heard that one.
No.
She is now a listener. The St. Pete Barkeep Blower. Roland Campos, sister of Chris. Sam Roberts, she who owns pigs and snakes, while her sister has her Ph.D. Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf. Christopher Walken's double, Steve Tucci. The great Rob Bartlett. Portia from St. Pete. Chris from St. Pete, Vic's Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Deviated Septum, producer Chris, Jenny Jingles, The Inimitable, Vincent Paulino, everybody, Eric Zane, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friends G-Back and Fez Watley, whose support of the show has never gone unappreciated, and they will always be missed. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. With these Invisaligns, it just sounds like I've been drinking too much, and I'm just sort of... it makes me sound a little bit like Rich Voss with my saliva. But anyway, go to our website at drsteve.com for schedules and podcasts, other crap. And I love Rich. Rich, I love you. I'm not saying that as a bad thing. We just sound alike. Until next time, check your stupid nuts for lumps, quit smoking and get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. All right, very good. Jeez.
Nice.
All right.
Cool, man.
All right, Lydia, can you sing?
No.
Oh, yeah, I was supposed to bring a song that she can sing.
But I'm going to listen.
No, she can sing the Iris DeMent song.
Oh, no, that's your...
No, I'm not. I wrote new words for it.
Did you?
Yes, I did. But I haven't finished them yet.
I can turn my mic off.
And I could use... You could sing Iris DeMent. Your voice and hers sound pretty much the same with talking.
I'm far too embarrassed to do that.
Lydia,
let me see.
You ain't heard embarrassed.
I'm about to next week, I hear.
You ain't heard embarrassed. Yeah, I have to take a lot of drugs to be able to.
Are we going to do that?
Listen to that shit. Yeah, we need to do Melissa.
Okay. So what we'll do is we'll play the thing that you recorded with those guys, and I'll try to clean it up. You got to remind me where that is.
Yeah.
Why did we never play that? I can't believe it.
Well, you saved it. You saved it on your computer downstairs.
I know, but we saved it forever.
Yeah. Yeah, we'll get it. Those guys they had so much fun doing that song.
Maybe we did.
They're like, that's the coolest. No, we never played on here.
We never played it. Okay.
They loved it.
Well, they're stupid. Oh no, they're not stupid. That's Sherwin Sleeves, but they're stupid in the sense that we're stupid, and if they like it, then they're dumb.
Oh, they're awesome.
I had the most effed up day today. I can't wait till October. I can just come in here and relax. Because, I mean, I have been everywhere today.
What's good about October?
Well, I'm not going to be assistant medical director anymore.
Oh, good.
I'm semi-retiring from that. Going to concentrate on seeing patients and teaching and then doing this. Nice. So I can spend more time on it.
Cool.
Because I used to spend 8 hours in show prep. Oh, here it is. I found it. Okay, here. She thinks possum stew tastes good. She makes her undies out of wood. She makes liquor out of corn. Her outhouse spider deserves her scorn. She's my baby. I'm her cousin. Never gonna let her go.
Oh, my.
He don't like no plain corn squeezins. Smoke from the still gets him a sneezing. Brings me sodies from Ernie's Market. Got a car, but he can't park it. He's my baby, and I'm his cousin. Never gonna let him go.
You wrote that, huh?
Yeah. And that's in spite of ourselves, we'll be eating lots of poke salad. Against all odds, all our kids will have 3 eyes. Oh, shit.
Oh, my God. Saved by the Bell.
Hey, are you coming up? Oh, you're on my phone, on my watch.
St. Barkeep blower is hilarious.
Hey, hey, sorry. Are you coming up?
No, I figured it was too late to come up, so I've just been down here waiting on y'all.
Okay, well, you can come on up if you want to.
Well, I don't want to listen to y'all play.
Okay, we'll be down just a little bit.
Thank you for the flowers, though.
Oh, that's Lydia brought those to you.
Oh, really?
Yep.
I did.
Oh,
You're going to like her. You guys got to drink together.
Very, very nice.
Yeah. Well, we'll be.
Make her listen to y'all play.
Okay, well, I'll send her down and she can refill her wine and you guys can talk. And we'll be down. Okay. All right. Bye.
Sounds good, huh? I'm working on the intro to that. Remember, we used to do that old Marshall Tucker song, This Old Cowboy.
Oh, yeah. We can still do that.
You leaving?
Yeah, go down and hang out with Tasty. We'll be down a little bit.
You don't know what you're going missing.
All right.
So you gonna play your song?
What song?
That one you just
No. Well, I got to give you the words. I haven't written the rest. I need some help. That's as far as I got. In spite of ourselves, we'll be eating lots of pork salad.
Well, hang on.
Against all odds, all our kids will have 3 eyes. We're gonna make some victuals for old Doc Carson. There'll be pawpaw fruits cooking in our pies. That's as far as I got.
That's hilarious.
So I'll keep working on it. All right, what do you want to play?
Do you remember the rhythm you used to play for that march?
Yeah, of course.
Yeah, I don't have the intro, but you had a bump, because it's G D, because it's just G D pretty much all the way through.
Yeah.
Until it goes to yeah, that's it. That's it right there.
Yeah.
You need more. Yeah, we need more volume on the
Yeah. And then how does the it goes? I'm an old what?
Yeah. So when it goes down to the chorus, it's a G.
Okay.
To A. And then it goes to a G minor, F sharp minor, and back to that A D. I'll show you in 2 seconds.
Okay.
Yeah. Let me get the where the hell did I put it? This is I'm working on a more jazzy kind of intro. This. Yeah, you've got that's the perfect rhythm. Yeah, but it's so real quick. The chorus is the G. I don't want you to think.
Wait,
you're
what is that?
the first one. G. Back to that D. Out here on my own. G, cause it's actually ain't gonna be the first time. F sharp minor, and then E minor, then A, and then back to that D.
Oh yeah.
Well, then it's the
yeah, but we never played that.
Yeah, I'll get that, and I'm gonna get a little jazzy thing, but it's but but it just kicks off on the it's technically a G suspended 6, but so. Well, I'm sitting down in San Antonio, waiting on that 8 o'clock train. My woman left me here last night. Things ain't been quite the same. Gotta get on back to Dallas, tie up a few loose ends. Gonna work a week, make $100, and hit that road again. Gee, I don't want you to think that you're the first one. Leave me out here on my own. G sharp, so that ain't gonna be first time. F sharp, E minor, A, G.
That's not how we used to play it. We used to do it a lot slower than that we do.
Yeah. Oh, okay, yeah, we could do, yeah. And then you kick it off. Yeah, there you go. Yeah, that's much better. Now, honey, I've been a fool, but a bigger fool. Said I can't remember when. Just to open up my heart, and let you walk right in. If there's just one
okay, we got to listen to each other.
Yeah,
we're not gonna. Yeah, we got the rhythm so off. So we may need to do this with a rhythm box, but
let me have it just a little more volume on you. Now, honey, I've been in Dallas, waiting on a 8 o'clock train. My woman left me here last night. Things have been quite the same. Gonna get on back to Dallas, tie up a few loose ends. Gonna work a week, make $100, hit that road again. Gee, I don't want you to think you're the first one. Leave me out here on my own, 'cause this ain't gonna be the first time this old cowboy spent that night alone. There you go. Now, honey, been a fool, but a bigger fool. Said I don't remember when. Just to open up my heart, and let you walk right in. If there's just one thing in this life, ain't hard for me to do. That's as soon as I kiss the lips of another woman, I forget all about you. I don't want you to think you're the first one. Leave me out here on my own, 'cause this ain't gonna be the first time this old cowboy spent that night alone. Now, I've been a fool, but a bigger fool, and I didn't remember when. Just to open up my heart and let you walk right in. Now, honey, gonna get on out of Texas, head on back to Tennessee. And as soon as I kiss the old state line, you'll have seen the end of me. I don't want you to think you're the first one. Leave me out here on my own. 'Cause this ain't gonna be the first time this old cowboy spent that night. Let's go chorus. Slow it down.
No, if you're gonna do a solo, I'm out.
I was just feeling it.
Okay, that's.
I know that wasn't bad. No, but that wasn't bad though. You know,
started to. It's been 3 years since we.
Yeah, it's been a long time. Yeah, Sean, sorry, buddy. He said it was good. No. It'll be much better. I promise, guys. That's the first time we tried that in 3 years. And but you know what I did? I quit looking at the words and started watching you. That's when I could start keeping time. Okay. So that's what I've got to start doing is just quit micro focusing on the words and just start watching you. Because when I see you change, I change.
Yeah,
my timing, yeah. Because I can time with my eyes, but not my ears.
Well, I've been saying forever I'm going to bring one of my drum machines in here. We need to do that. But.
Sounds good. All right, boys and girls, ladies and gentlemen, we'll go practice.
We ought to end on a damn high note.
Yeah, let's play a good one then. Let's do one. Hang on, guys, one more. You're not going to make me do Thrill of the Gun, are you?
It's been 4 years since we played this.
There has gone. There has gone away. There has gone. There has gone away. Someday I'll move on. You'll be sorry someday.
Now, BB. I can get you some tabs for some BB King solos for this.
Thrill is gone. Thrill has gone away. Thrill is gone. Thrill has gone away. Someday I'll move on, and you'll be sorry. So sorry, I say. There has gone. There gone. Thrilla's gone for good. Someday I'll move on and leave you like a good man should. Thrilla's gone. Thrilla's gone away. Thrilla's gone now. Thrilla's gone for good. Someday I'll move on. I'm so sorry you'll be.
Yeah. I thought we were going to end on a high note, but sorry about that.
That was even worse. Sorry, guys. That'll teach Dr. Steve to play the blues. See you guys.
Thank you all for indulging us.
Take care, man.
We love you all.
Bye, Amanda. Thank you, Thank you, Amanda. See you, Derek. See you, Colin. Hey, Colin, I hope you heard that question we got at the end of the podcast.
Yeah, PA Lydia is the best.
She rocks.
We will one of these days actually play a good song.
Yes, we will.
Oh, we will. We've played good songs. We've just played them poorly.
Songs.
We will do.
Well, we don't do a great job.
Well, we should practice. If we just practice one time, just one freaking time,
just one day. Yeah, I know. Other than 30 for 15 minutes a month. All right, let's get at it, brother.
Sean, he thinks the St. Pete barkeep blower is hilarious, and so do I. And there is a story that I cannot tell.
And on that
but
note,
she knows who she is.
And on that note, we're out. See you, man.
All right, bye.